Clinical trials are studies that involve patients. These are studies that evaluate new medications or new ways of using medications, and we do a lot of them at our center. I don't like any of that. Get rid of that one. Okay, let's try again. There we go. Clinical trials are studies that involve patients. The way that we develop new medications and new ways of using medications is through clinical trials. So I'd really like to encourage those of you who might be able to consider at least getting involved in clinical trials. A lot of clinical trials look at patients very early in Parkinson's disease before one goes on symptomatic medication, because at that point in the disease we can follow the progression by looking at the signs and symptoms of the disease, how much slowness, how much stiffness, how much tremor, and the signs and symptoms basically track with the disease. Once a person goes on symptomatic medication, they improve even though the underlying disease didn't improve, and so we have the confound of symptomatic medication, or symptomatic medication obscures our ability to see and follow the progression of the disease. So if you're newly diagnosed and not yet on symptomatic medication, at least consider if there are clinical trials available in your area and think about those before you go on symptomatic medication. A lot of other clinical trials are for the late end of the disease, once patients are on levodopa and finding that the levodopa is not lasting from dose to dose. There are a number of new medications that are either added to levodopa to try to smooth out the response, or new long-acting levodopa formulations, again to try and smooth that response. A lot of advances are being made in that area, so if you're on levodopa and finding that it's not lasting from dose to dose, again, avail yourself of clinical trials. Along with those fluctuations, many patients have dyskinesia or twisting turning. There are a number of medications being evaluated for the treatment of dyskinesia, so that's another important area of investigation. Can you find clinical trials? Well, if you're in an area where within an hour or so drive there's a university, you can call up the university and ask for the Parkinson's Disease Center. Sometimes it's called the Movement Disorder Center, and talk to the center there, see what clinical trials they have. They may also have a website that you could search for. The other way is the Michael J. Fox Foundation has a website called Fox Finder. You can look for trials there and even list your name as someone who's interested in looking for a trial, and you'll see there an explanation that you might be contacted by a site or an individual who has a trial underway. A little more sophisticated way is you can go to a government-run website called clinicaltrials.gov, and if you search under Parkinson's disease, you'll see a whole list of all the clinical trials that are being done in Parkinson's disease, and you can look through that and see what might apply to you. A lot of times it'll list the centers that are doing that. If you see a center near you, you may be able to call that center and ask about the trial. So I'm a big proponent of studies. Investigators can't do it themselves, pharmaceutical companies can't do it themselves, NIH can't do it itself. It really takes a team effort, and patients really need to participate in trials to get better medications to help themselves. So we have the medications we have today because investigators and companies and NIH did what they did previously to get us the stuff we have today, and we need to do our part to bring new medications and new treatments into the world for the future. So please do think about enrolling in a clinical trial if you can.